Hey guys, thank you so much for joining me on WellnessKE. My name is Fatma. Here on WellnessKE, we like to offer women great information and also solutions to help them balance their hormones through fitness, nutrition, and hormonal balance. So, today we're going to be talking about PCOS. So, keep watching. So PCOS actually stands for Polycystic Ovarian Syndrome. And poly simply means multiple or many. Cystic means cysts. Ovarian syndrome meaning it's a syndrome that affects the ovaries. So in simple terms, polycystic ovarian syndrome is a condition that causes multiple cysts in the ovaries. So a woman that actually has PCOS basically has lots of cysts that are formed in her ovaries. So I really want for you to understand certain things before we go way too far into the conversation. Number one, it's the fact that PCOS actually happens to be one of the most common endocrinological conditions that currently are affecting women. This word endocrinological is actually a really big word, but it simply just stands for a condition that affects the endocrine system, and the endocrine system is responsible for hormonal balance. So whenever a woman actually ends up having hormonal imbalance, it's very important for her to find a system that's going to help her in bringing back that state of balance when it comes to her hormones. So there's certain things that I really want for you to understand. Number one, it's the word cyst. So cysts are basically non-cancerous growths that actually form, and they can either form internally or externally. But what do they contain? Cysts normally either contain a liquid or a semi-solid substance. So something that I really want for you to take away is the fact that cysts are absolutely not normal. So as a woman, if you do find that you have a cyst, then it's important that you seek medical attention and you can be able to find a solution for that issue. So as I mentioned, cysts can either form internally or externally, but for the sake of this conversation and for the sake of PCOS, I'm only going to focus on the cysts that actually occur internally, because they do occur in the ovaries. Another term that I really wanted to mention before we go into the conversation is androgens. Androgens are basically hormones, and these hormones are commonly known as the male hormone, but they do also occur, or they're also produced in the female body. And androgens are hormones that are really responsible for your reproduction and also for growth. And we find that when the ovaries in a woman actually produce excessive androgens, we have a condition known as hyperandrogenism, and this is directly linked to PCOS. So now let's really get into the conversation of PCOS, because I want for you to understand who really is at risk of PCOS. So starting from, when a woman is young, a little girl, number one, the one person that is at risk of PCOS is a girl that actually, when they get into puberty and they get their period quite late. So any type of, female that actually gets their period quite late is highly susceptible to PCOS. So this is very important also, for parents who are raising little girls or young girls. Look out for that. If you find that your girl actually got their period quite late, then you can be on the lookout and make sure that you take care of their health to avoid any kind of conditions later on. Also, another person that is highly likely to have PCOS is any woman that is pregnant and has type 1 or type 2 diabetes. So this is also known as gestational diabetes. It's diabetes that is diagnosed during pregnancy. So this is also, a person that is highly susceptible to PCOS. Another group of women that are susceptible to PCOS are women who are overweight or obese. So if you want to know whether you are overweight or obese, it's important for you to know your weight, your height, and you check your body mass index. So another group that is susceptible to PCOS, we're going to go back to that little girl or the child for this particular part of the conversation. When a female child is born either too large or too small for their age. actually really important for a parent, for parents to actually have this kind of information, because there have been links to either, children who are either born either too large or too small for their age, and they are directly linked to PCOS. So it's very important for parents to have this information also for the sake of their young girls as they turn into, young adults, so that they can be able to also track their health and make sure that they stay healthy. And I really feel like this part is important for all of us to remember. So now that we've, discussed the group of women who have or are highly susceptible to having PCOS, I want for us to now talk about the signs and symptoms, because this part is really important. This is the reason why you're probably watching the video, so that you can know whether you do have PCOS or not. The very first sign and symptom is acne. And I'm not talking about the normal acne. I'm talking about cystic acne. And cystic acne is quite different from the normal acne because it's very lumpy and it can actually be painful. So acne is one of the signs and symptoms of PCOS. Another one is hair loss. Now, we did mention that, the excessive production of androgens, is something that is directly linked to women who have PCOS. And this is because the women tend to have male-like characteristics. And so, whenever men actually lose hair when they're balding, this is also something that can happen to women who have PCOS. So there's kind of a link there with hair loss. Another very important sign and symptom that we need to remember is irregular menstrual cycle, or the lack of periods thereof, because there are some women who mention that they've actually missed their periods completely for months, and this is something that is definitely not normal. So you find that some women actually either have a cycle this month and then they actually stay for about 5 months and have another cycle, so it's quite irregular. And we know that a cycle is supposed to happen each month. So if you do find that you have irregular menstrual cycle, or you actually have no periods at all, it's important for you to look into that and to seek medical attention. Another important sign and symptom that we need to mention is infertility. Infertility is an issue that currently is affecting many women, and it is such a struggle that I feel it's important that we even have a whole separate video on infertility. But for today, this is one of the signs and symptoms of PCOS. And I really don't want to get too scientific, but I really want for you to understand how PCOS causes infertility. So here's the thing, whenever your reproductive system works so that you can be able to be fertile, there are many moving parts. And the thing about PCOS is we find that these cysts that form on the ovaries actually block ovulation from taking place. And if you remember your high school science, ovulation is basically that process whereby your ovaries produces this egg, and this egg is supposed to move, through the fallopian tube, because it's supposed to be fertilized by the sperm, and then once it's fertilized, that's when it ends up in the uterus and it starts forming a baby. The thing is that with a woman who has PCOS, they actually have these cysts, and these cysts tend to block ovulation. So it's actually quite difficult for women to get pregnant without ovulation. This is actually how a woman ends up being pregnant. So that's why it's really important for us to, learn more about our bodies, our reproductive health, and also specifically PCOS, and actually finding a solution so that, you can end up having the family that I'm sure you really want to have. Something else that I really want for you to take away that directly links infertility to PCOS. Here's the thing, whenever you have your menstruation, your periods actually happen because whenever your uterus lining called the endometrium thickens, it thickens so that it can wait for that fertilized egg. Whenever it gets to that part of your uterus, it's supposed to thicken and create a nice environment for the egg to develop into a baby, right? As while it is in the uterus. The thing is that whenever there is no fertilization that takes place between the egg and the sperm, what happens is the endometrium had already started thickening, waiting for the baby, to develop. But because there is none, in the uterus, this endometrium or this thick wall and lining starts shedding. So when it sheds is when you have your menstruation. The thing is that a woman that has PCOS doesn't have their periods. And so because they don't have their menstrual periods, what happens is this endometrium keeps on thickening and the walls keep on thickening. And this is what is known as endometrial hyperplasia, which means, it just keeps thickening and nothing happens, there's no shedding. And that actually is directly linked to endometrial cancer. So it's very important for women to understand the dangers, or rather, the risks that can come from such a condition as PCOS. And this information is not to scare you, but it's for you to know how far it can go and how important it is for you to actually find solutions right now so that you can be well and find, hormonal balance and to be healthy. So these are some of the signs and symptoms of PCOS. And now I want for us to look at how can you know that you have PCOS? What tests do you have to do? And also, what do you do after that? This part is really important. So it's really important for you to know these hormones that your doctor is going to be checking for in order for them to find out whether you do have PCOS. And the first hormone we're going to talk about is FSH, follicle stimulating hormone. This hormone is actually responsible or gives you the ability to be pregnant. So if they do check your FSH levels and find that they are lower than normal or slightly normal, then it could be that you have PCOS. The second hormone that they are going to be checking for is the LH. LH simply stands for luteinizing hormone. This hormone is responsible for encouraging ovulation. And as we mentioned, women who have PCOS actually have the cysts in the ovaries that block or stop ovulation. So they're going to be checking for your luteinizing hormone, and if they do find that the hormones are actually higher than normal, then it could be that you have PCOS. Another important hormone for them to check is the estrogen hormone. Estrogen is the female hormone that is also responsible for you to have your menstrual cycle. So it's responsible for you having your periods. And as we mentioned, women who have PCOS actually have irregular menstrual cycle, and sometimes they have no cycle at all. So they're going to check for your estrogen levels, and if they find that they are higher than normal or slightly normal, it could be that you do have PCOS. Another important hormone that they're going to check for is testosterone. This one is a little bit hard for me to say, but I've said it. So if they do check for this particular hormone, they're going to try and find out whether the levels are actually higher than normal. Because as we mentioned, women who have PCOS tend to have high levels of androgens, which do happen to be a male-like hormone. So high levels of testosterone could be directly linked to PCOS. So I really wanted for you to understand some of the hormones that your doctor is going to be checking for. And if you do feel like you suspect that you might have PCOS, it's important that you ask important questions to your doctor. Let them carry out the tests, ask them questions about how you can be able to balance your hormones and some of the options that they're going to give you. So this part is really, really important. Women who have PCOS really need to find a way to manage this condition, because they do end up having a higher chance or risk of having other conditions. And I really wanted for us to walk through some of these conditions that could affect women that have PCOS. The first one is diabetes, and we all know diabetes is actually a condition that is caused by high levels of glucose, or raising your blood sugar levels continuously, which does lead to insulin resistance, meaning your own body just does not really work well with your pancreas as it keeps releasing insulin to counter whenever you eat foods that are high in sugar or high or certain carbohydrates that are actually refined carbohydrates, your body tends to go into a state of insulin resistance, and it can also lead to diabetes. So this is really important for you to know if you do have PCOS, a condition or a risk factor that is caused by this particular condition. Another one is endometrial cancer. As I mentioned before, endometrial cancer actually comes about because the thickening or the lining of your uterus, the endometrium, actually keeps on getting thicker. And if you don't have your menstrual cycle, that means this thickened wall or lining does not shed at all. So it keeps on thickening, and that could potentially lead to endometrial cancer. And also, this condition whereby this endometrium keeps thickening is known as endometrial hyperplasia. And so this is also another risk factor of PCOS. So now I want for you to know exactly what you need to do if you find out you have PCOS and how you can manage this condition. So one of the most natural ways for you to manage PCOS is by managing your weight. So women who can actually lose 5 to 10% of their excessive weight tend to see some changes, positive changes in their bodies when it comes to PCOS. And some of these changes include getting their cycle back, so meaning it ends up regulating their cycle, so they end up having their periods. Another one is also ovulation. It actually starts helping them when it comes to their reproductive health and also ovulation, so meaning issues like fertility end up being, issues of the past. And another thing that is going to help you with is to manage your blood sugar levels. This part is actually really important because high blood sugar levels, as you know, could lead to insulin resistance and also diabetes. So trying to include some physical activity in your day-to-day life, some exercise. You can actually go on YouTube and find some workouts. And here on WellnessKE, we actually have a fitness plan that can help you step by step, a 30-day subscription that can help you in managing your weight from home, and you can be able to have an accountability coach that will take you through your fitness as you keep on improving your health and your well-being. Another thing that's actually really important to mention is changing your diet. So switching your diet from, you need to stop eating foods that are high in sugars, meaning foods that are, high in refined carbohydrates, like your white bread, white pasta, white rice, and also foods that are really high in sugars, because as we've mentioned, women who have PCOS actually have, a link to conditions like diabetes, gestational diabetes, insulin resistance. So it's really important for you to watch your diet, eating foods high in good fats, and also reducing or making sure that you don't eat foods that are high in sugars. This is really important. And also just eating a clean, wholesome kind of diet that's going to help you in taking care of your health. So your leafy greens, your foods like broccoli, cauliflower, your vegetables, also healthy sources of protein, lean protein, because as you know, PCOS is also linked to cardiovascular disease, and also checking your cholesterol levels and making sure that you eat food that is clean, that will eventually help you with your health. So these two are actually really important. And I have to mention that at WellnessKE, we do have an amazing nutrition plan that can help you also, a 30-day nutrition plan that can actually help you develop healthy eating habits for life and balancing your hormones. So I really hope that you found this video helpful and you got to learn something about PCOS, about your body, and about how you can be able to manage and take care of your health and your well-being. Thank you so much for watching. Make sure that you like and share this video. Also, comment below about anything else that you found was super useful from this video. We love hearing your feedback. And thank you so much for watching. My name is Fatma, and I'll see you guys next time. Bye.